Good morning. My name is Mr. Sameer Trikha. I'm a consultant ophthalmic surgeon with a specialist interest in cataract and glaucoma surgery based in the Harley Street district of London and also at the Circle Hospital in Runnymede, Chertsey, Surrey. To answer the question regarding what patients shouldn't really do after surgery, well, there are a few things they should try and abstain from before resuming. And these are activities such as bending, heavy lifting, or straining, which might typically happen if they're in the gym or doing weights, etc. They should tend to avoid that for a period of time, normally a couple of weeks. In addition to avoiding strenuous physical activity like running very fast or bending, and as I mentioned previously, heavy lifting as well. Other things that they should try and avoid doing for a period of about 6 weeks include swimming and avoiding getting any sort of dirty water into the eyes, which would potentially increase the risk of infection. So those are the main things that patients should avoid in the immediate period after cataract surgery. Yes, so the use of computer screens, mobile phone, tablets, etc., should be minimized really in the first few days after cataract surgery. The reason being is once cataract surgery has been performed, the eyes can be inflamed for a few days, and that gives symptoms such as light sensitivity and aching or some discomfort in the eyes, and that can be exacerbated by using a screen for the first few days. Often, I tell patients their eyes will let them know what they can and cannot do. And when we use a screen, what happens is our blink rate reduces and we start to focus intensely. And over a short period of time, that can cause aching and discomfort. So I actually tell patients to avoid using screens for the first 2 days at least, for the first 48 hours. And as the eyes settle down, they may wish to introduce that very gradually, just for short amounts of time, for example, 15-minute blocks. So typical activities, patients can go for a gentle walk, for example. They can sit outside. They can walk around if they want to do those sorts of things. Um, those are absolutely fine to do in the first day following cataract surgery. Other things should be avoided in the first week, which include avoiding strenuous activities such as going to the gym or heavy lifting, and that can be included after approximately 2 weeks or so. Avoid things like bending, yoga, these sorts of things should try and be avoided for the first 2 weeks or so after surgery whilst the eye settles down. In addition, swimming should be avoided for about 6 weeks until the eyes fully heal, and that will mean that the eyes are there's a lower risk of infection when they do if you do decide to go back and swim at that period of time. Generally, the answer to that is no. Although interestingly, I recently operated on a patient who was a deep sea diver, and having discussed his specific requirements, we actually decided to defer going back to his full job after about 3 months. That's a relatively rare case, and of course, patients may have very specific visual needs, in which case we can look at their individual circumstances to decide the appropriate time to go back to those activities. But generally speaking, for the vast majority of patients, they are fine to resume most activities and go back to their normal life within a few weeks after surgery.